Good afternoon. Welcome in. Hello, everyone. Thank you for joining the National African American Child and Family Research Center's Capacity Building webinar. So we're going to get started. This webinar is focused on our center's assessment of existing data for the African American family research that we conduct. And I will present briefly, and then we will hear from our OPRE colleagues, including our project officer and steering committee member. And I will moderate any discussion and questions that we have at the very end. All right, so I'd like to start by introducing to some and reminding others about the center. And our mission is to provide national leadership and excellence in community engaged research to better serve African American children and families. Our goals are to advance research, to build research capacity, as well as to communicate research. Our center focuses on the Temporary Assistance for Needy Families program, or otherwise known as welfare. We also focus in on Head Start and Early Head Start programs and child care assistance programs. We also have some cross-cutting areas that we look at across these programs, which includes rural populations, looking at families that have been affected by the legal system. We're also looking at health issues, fatherhood, just because we know there are fathers in families, but a lot of times we don't do a lot of research on African-American fathers in these programs. And we also do some research around spatial and geographic analyses, which are conducted by our partners at the Georgia Institute of Technology. So within these priority programs, we are assessing definitions and measurements of the needs and assets and experiences of African American children and families. And that is in bold because that is what we're really focusing in on today. And so we also look at barriers and facilitators that impact service provision to African Americans. We also look at strategies and promising approaches to service provision for African American children and families. All right, so I want to provide some background on our data assessment. And you all can use the chat, but how many of you have heard we don't need any more research on African American families or our communities? We know all we need to know to take action. Or you may have heard, why am I always being researched, as we see in this study that was done by Chicago Beyond. And so as a community-based participatory researcher, I hear these comments often. And I just want to share a few reasons why new research with, not on, African-American families matters. And so the first reason, research is needed to address historical inequities and systemic racism. Previous research often overlooked and misrepresented the experiences of African American families, leading to inaccurate conclusions as well as ineffective programs and policies. Well, one would say that these programs operate as they were designed, but nonetheless, the documentation of these inequities through stories and statistics help us understand the magnitude and the impact of an issue. We also need to document and understand complex issues and root causes. Research tailored to African American families can pinpoint unique challenges related to health, education, economic stability, et cetera. And that just may not be apparent or looked at in some broader studies. Research is also needed to promote resilience as well as strengthen our families and communities. So by highlighting the diversity and resilience of our families, research can combat negative stereotypes and also promote a more accurate representation. We also need research to understand cultural nuances within African American families, which allow for the development of interventions and programs, as well as policies that are more relevant and effective. Also, evidence from research with African American families can be used to advocate for policy changes that address systemic inequities, as well as support Black communities. And finally, when research actively engages with African American communities, it can support them to identify, advocate for, as well as address their own needs. And so these are just a few reasons. If you have other reasons, or even if you disagree, this is an open space. Feel free to share your comments in the chat. we can all learn from each other here in this space. All right, so as a center task was developing a community engaged research agenda, we first conducted an assessment to identify research areas and questions. The assessment included primary data collection, where we talked with community leaders as well as parents who participate or likely eligible to participate in these programs I described earlier. And also to avoid reinventing the wheel and also to reduce any burden on our participants, we conducted secondary data analysis, looking at existing data in national surveys and state and federal administrative data. Before we could do any analysis, though, of course, we had to figure out which data sets had the data that we could use to describe families and their program experiences. All right, so there are obviously some pros and cons to using secondary data. The pro for us, like I said, is not having to burden our families or leaders or providers with surveys or interviews on information that's already available. And so when focusing on African American families, though, there are well-known challenges. And so we will reframe these as areas of opportunity because hopefully the center will be able to fill a gap in these areas over time. But first, we will say that there is historical and I'll add justified mistrust of research within the community, which often leads to a lack of participation, which hinders representation in data sets. Also, the lack of disaggregated data by race is a common challenge. Researchers often do not have access to data broken down into smaller subgroups across racial groups or within the African American population. And this can sometimes mask significant inequities within or across communities and also hinder targeted, effective programs and policies. The lack of nuance in racial categories, similar to the above point about disaggregated data, but also adding that Black and African American categories are usually put together, but they are very different. Also, you could just think about the Hispanic population, you can think about Asian populations. There's just a number of different countries and cultures and communities that are represented within those broad categories. And so, when we lump them all together, the differences within that population or those geographies may lead us to not understanding the different needs and experiences of that group. There's also underrepresentation in certain Black subgroups. So that really refers to some data not adequately representing the diversity of Black families across socioeconomic backgrounds, gender. I know a lot of times I'm trying to find specifically about Black men or Black women in anyway, so geographic regions, sexual orientation, family structures, all of these kind of lack of information about the subgroups within a population may potentially lead us to skew results or have some over generalizations. Finally, existing data sets may focus more on negative aspects of African American families and neglect to capture the strengths and the resilience and positive coping mechanisms within many families. All right, so keeping all that in mind, we still wanted to see if there was some existing data that we could use. As a team, we discussed and agreed upon some common research interest or areas that we would see if there was some existing data on these topics, particularly as it related to African American families, and specifically, again, those in our targeted programs. So we were interested in existing data on families and communities, such as their characteristics, which was really just looking at the demographic data, race, ethnicity, gender, income, sexual orientation, et cetera. We also looked at the ability to do spatial analysis, so seeing what kind of location data was available in each of the data sets, whether it was zip code, county, state, census tracts. We looked at neighborhood dynamics. That could be any kind of rankings type of data on the community, looking at community resources, assets. Also looked at any surveys that asked about experiences with racism or discrimination. Regarding health, we wanted to see if there was information about health insurance, mental health, or ability status. With fatherhood, we were looking at residential status and child support. Family dynamics included residential status, marriage rates, moving or changing residence, housing stability, renting, owning, multiple partner fertility, household size, and then legal system involvement. Could be information about the type of crime, a type of legal system involvement, and any state policies on program access, or potential bans to access some of the programs. And then as far as program experiences, we wanted to assess existing data on TANF, Head Start, and Child Care Assistance Program experiences, such as how many African Americans participated in the program. Also looking at economic mobility, which was referring to job quality, type, and number of jobs available within a geographic area. We also wanted to look at data on TANF work requirements, work incentives, work participation rates, employment rates of TANF recipients, any earnings 6 months after employment, data on sanctions, data on the types of work activity. We also wanted to learn more about applications that were received and denied, and specifically a reason for denial. We also wanted some information about child care providers, how many were African American, and some descriptives about their care locations, including the type of provider and where they were located. Okay, so based on our research experience and learning from our steering committee and other researchers, we selected several data sets, several surveys to assess if they contained any of these data. And I'll just briefly describe these national surveys. It's just a few of them that we looked at. We did look at more, but these are just a few. So with the National Survey of Family Growth, this is a survey that gathers information on pregnancy and births, marriage and cohabitation, infertility, use of contraception, family life, and general and reproductive health. The National Survey of American Life, this was a survey that was intended to investigate the nature, severity, and impairment of mental disorders among national samples of Black and non-Hispanic populations, non-Hispanic white populations in the U.S. Census. And then speaking of the census, I'm sure you all are familiar with American Community Survey, which is a source of information about housing, population data, as well as the workforce. The Household Pulse Survey also measures how emergent issues are impacting households, particularly from a social and economic perspective. The Survey of Income and Program Participation is a representative longitudinal survey that provides information on the dynamics of income, employment, household composition, and government program participation. The Center for American Progress Survey on LGBTQI experiences. This is a nationally representative survey that collects data on the lives, attitudes, and experiences of LGBTQI populations. The Behavioral Risk Factor Surveillance Survey system, anyway, it collects state data about residents' health-related risk behaviors, chronic health conditions, as well as the use of preventive services. And then we looked at the National Health Interview Survey, which provides insights into the health of people across age, sex, race, ethnicity, geographic locations, and social and economic circumstances. And then finally, we looked at the Social Vulnerability Index, which is a place-based index, and it helps to identify and quantify communities that experience social vulnerability. National data pertaining to some of our programs, so Head Start, Family and Child Experiences Survey, we looked at this one. It also provides some nationally representative information on characteristics, experiences, and the development of Head Start children and families. And it also provides some data and characteristics on Head Start programs and staff. We also looked at the National Survey of Early Care and Education, which includes information about early care and education services available throughout the United States and how families with young children select and pay for child care services. The Survey of Household Economics and Decision-Making, it measures the economic well-being of U.S. households and identifies potential risks to their finances. The State Unemployment Insurance is self-explanatory, but that's data from the Department of Labor by state. And then finally, the Future of Families and Child Well-Being. This is was originally called the Fragile Families Dataset, but it was designed to answer questions such as what are the conditions and capabilities of unmarried parents, especially fathers? What is the nature of the relationships between unmarried parents? How do children born into these families fare? And how do policies and environmental conditions affect families and children? So these were the national data sets and surveys data that we looked at. Then we also looked at the Administration for Children and Families, or ACF's administrative data. So looking specifically at the data that's collected about the TANF program, and also data that's collected about the Child Care Assistance Program. And then the Program Information Report is data collected from Head Start programs. Okay, as a center, we have focused our efforts in our assessment primarily on states that have a high population of African Americans who are participating in these programs. And so you see the 9 states that we have focused on listed there. And each of these states had their own child care assistance data, I guess you could say website, or some of them had a data dashboard, but most of these websites were either housed in their Department of Education, the Department of Human Resources, or Department of Child and Family Services. And so we were able to look through each of those and again see what data they had available to answer some of our research interests and questions. All right, so our research assistant and data analyst, Andrew Cooper, giving him a shout out. He developed this heat map strategy to document and visualize the level of data that was available by research interest as well as by program for each of the data sets. The color green really represented that particular data set had sufficient quality data available in that area. Yellow data was available, but limited or imperfect. And then red was insufficient. The data was not found. As you can see, there are a lot of reds and not many green in this particular screenshot, but nonetheless, I am going to walk you through what is available and what sufficient and limited availability mean in each of these cases. All right. So when we were trying to find data to describe our families who participate in the Temporary Assistance for Needy Families program, there is sufficient data in the survey of income and program participation, just as far as it is describing the characteristics of African American families in Head Start and Child Care Assistance. Specifically for TANF, it contains data on the family household structure and socioeconomic characteristics of African American families who participate in TANF. I will say with all of these, there are some limitations, but nonetheless, there is some data there. TANF reporting system, it does include data on how many African American families receive TANF, of course, and also Medicaid and TANF and Social Security benefits. It also includes data on the participants' family household structure. And then the Future of Families and Child Wellbeing data set is very robust. It has a wealth of data on various characteristics of young families. And again, the benefit of this one is that they follow the families over time. However, the data are not recent, and don't quote me. I want to say that the latest data set might be 2014 or so. But at any rate, that it is comprehensive in the set of data that they look at, but it's not like 2022 or 2023 data. There is sufficient data about African Americans who participate in TANF in the American Community Survey or census as it relates to their socioeconomic status, income, family household structure, and county as a geographic indicator. It is limited though in the sense that they bucket TANF, SSI, and SNAP together as a family receiving public assistance. They don't look at or have a variable that identifies those who receive TANF alone. Okay, when trying to find existing data on our families who participate in child care assistance programs, there is sufficient data in the survey of income and program participation. So it has the characteristics of the families. Also, these 3 remaining data sets, the National Survey of Early Care and Education, Future of Families, and the administrative data set, the Child Care Development Fund data, they all contain data on the characteristics of families and how many African Americans participate in child care assistance programs. There is limited data in the household pulse survey. They do have, data on the family characteristics. The Head Start Family and Child Care Experiences Survey does have the number of African Americans participating as well as family characteristics. The Survey of Household Economics and Decision Making also, as well as the Office of Child Care, their child care assistance data, they both have information on family characteristics. When looking at those families who are participating in the Head Start program, there's sufficient data again, survey of income and program participation. As I said, they do talk about the characteristics of the families. Same with Head Start Family and Child Experiences Survey. There's limited data in the program information report in terms of, it definitely has how many participate, but it's limited in terms of the characteristics of the children and families, including geographic data. There's not a lot of geographic data there, and there's some limited data on the receipt of TANF and Medicaid as well. All right, when we are trying to understand program experiences, they're specifically looking at the child care assistance programs. There's limited data on denial and ineligibility for child care assistance in the National Survey of Early Care and Education. There's no data on applicants, but there is some variable for the program refusing the child. So there may be some reasons in that data, such as child behavioral problems or lack of space. There's also the Maryland Child Care data set that does have some data on the number of applicants to the Child Care Assistance Program, and the Survey of Household Economics and Decision Making has some of the socioeconomic characteristics of families who were seeking child care assistance. With the child care provider data, we did see that in the National Survey of Early Care and Education, specifically how many of those providers are African American. You can find that in that data set. When looking at experiences with TANF, there are limited data as it relates to sanctions and work activity. So in the TANF reporting system, it does not report sanctions data by race. Sanctions data is in there, but just not by race. The Survey of Income and Program Participation reports sanction data and additional questions on TANF receipt ending. The type of work activity by race is not listed in the TANF reporting system. Limited earnings and job quality data is available in the Survey of Household Economics and Decision Making. They do have a question that asks if they received TANF in the last 12 months and their work dynamics. The American Community Survey includes, of course, information about folks' participation in the workforce and occupation data. There was some limited data on program experiences as it related to Head Start in the Program Information Report, or PIR, meaning there's some data on characteristics of families who were seeking to enroll in Head Start. All right, so we are going to be publishing the findings of this assessment as a resource to you, so please be on the lookout for that and more information. Just trying to give you all a brief synopsis of what we were able to find. There are also some websites that list different data sets by topic that you can explore for your research. And so just keep in mind some of what was shared here today as you're looking at those data sets and wondering what all is possible and what's available. All right, so I'd love to acknowledge our research team and co-investigators who continually monitor. This is not a project that has ended. This is something we are continually doing, looking at these data sets and making sure we're using the most relevant data. And so they're listed here, but now I am going to turn it over to our OPRE colleagues. And I think, is she here, or is it you solo?
No, Megan is here. She's having some tech issues, but she's on the phone.
Oh, okay. Well, let me properly introduce you all. So Dr. Megan Reid is our project officer, and Dr. Amanda Coleman is our steering committee member. Megan Reid is a senior social science research analyst at ACFRC, Division of Economic Independence. She is particularly interested in research that can contribute to understanding and ameliorating the structural inequities that cause poverty. And at OPRE, her work focuses on employment interventions, employer processes, child support programs, family economic stability and equity. Dr. Amanda Coleman is the Deputy Director at the Administration for Children and Families, Office of Planning, Research and Evaluation, Division of Child and Family Development. She works closely with the Division Director, providing strategic leadership and management across the division's portfolio of research. She also oversees OPRE's internal efforts to embed equity into their research, evaluation, and data work. Welcome, ladies. Floor is yours.
Hey, thank you so much. Okay, I'm going to share some slides. Okay, perfect. Great. So thank you, Dr. Rollins. Megan and I are going to share a few reflections. I'll kick us off and then turn it over to Megan. So, I think Megan and I are very appreciative of the opportunity to come and reflect a little bit on the center's work, looking at existing data sets for African American children and families. And I think the first thing that we want to emphasize is just the importance of what the center is trying to do to increase our understanding of the availability of data, to understand the characteristics and experiences of African American children, families, communities that may interact with programs that are overseen by the Administration for Children and Families. I think we all here know that African American communities have really a unique constellation of structural factors that shape their experiences in this country, their access, their utilization, and the quality of services that they receive and their outcomes. So, leveraging existing data holds so much promise for addressing questions that can improve ACF's ability to serve and support African American families. But I think as the data scan results indicate, there are some challenges with whether the data can be broken out by race, whether important constructs are captured, and other issues. So in my remarks today, I just want to share a few considerations as you reflect on the work that the center shared today, and even your own work, utilizing national data sets and administrative data sets on Black families. So I first want to just focus just a bit on administrative data, because I think that is a really, really important source of information. So as the center's work emphasized, there are a number of challenges with administrative data. And I think one thing that as researchers is important for all of us to keep in mind is that administrative data sources were originally designed for a completely different purpose than what we as researchers are often trying to use the data for. I think as researchers, we all know how to kind of design a research study, that the methods, the design, the data all flow from the research questions. And with administrative data, the data may be for the purpose of routine monitoring, to support carrying out program functions, to meet legislative reporting requirements, or other non-research purposes. And I think as researchers, we're often trying to fit the data to match our questions, which can be really, really difficult. These data sets are often huge, large, complex. The documentation may not always be comprehensive and complete in the way that we need them to be complete to answer important policy and practice relevant questions. And when I think about these challenges, I think they actually reveal important opportunities for strengthening partnerships between local, state, county, federal government, and researchers. So, we're in a time where there's increasing calls for government entities to use administrative data and other data to build evidence, to inform decision-making. And there's a real need for bringing in the skills of researchers, those who know data very well, into these efforts. And I'll just make a quick plug that OPRE funds a number of research agency program partnerships in the early childhood space, so in Head Start in particular, and in childcare. And you can visit our website to learn more about future funding opportunities. We really do see this as an important area where researchers and folks within government can work together. So the other challenge that I just want to highlight, focused on administrative data, is that unlike the K through 12 system, where when you think about schools in general, there's some comparable data that are collected across all publicly funded schools. In early childhood, we don't really have sort of that same kind of comprehensive system across early childhood programs. This is a field that is very, very siloed, that you have very different data are collected on different timelines through different systems, looking at different things. And you see that when you look at Head Start, when you look at childcare assistance, and when you look at public pre-K. This means that there's really no central place to examine what ECE services are all children receiving across the country and what their outcomes look like, let alone to zero in on African American families. Luckily, we do have survey data that Dr. Rollins talked about that can, give us some insights, but we may be limited in some ways by sample sizes for some of these studies, especially if we're really interested in starting to look at kind of small subgroups and heterogeneity within African American families. But despite these challenges, I do, think that there's a lot of benefit in continuing to think about leveraging administrative data for research and evaluation. It, number one, poses less burden on families, on children, on staff, because these are data that are being collected as part of the normal course, typically, of work or the operation of a program. You have this data available in theory for all participants rather than just a sample. It may be more cost effective in many ways. To say, I think I essentially want to communicate that I think despite the challenges, it's definitely worth continuing to explore opportunities to use administrative data to address policy relevant questions. And I think the last point I want to make before turning it over to Megan is that both administrative data and survey data are needed to answer new and emerging policy questions. I think when people often think about data informing policy, they often think about what we call the big P policy, which is legislation, which is kind of what Congress, drafts and works on. However, in the executive branch, specifically within federal agencies, folks are routinely making policies through rules and regulations that govern the operation of federal programs, and that ultimately can impact the lives of African American children and families. And we often call this the little P policy. And federal agencies use research, and they need research to inform decisions and to also just know how current policies are being implemented and how they're working. And there are several new policies in the early childhood space that I think are ripe for research. So earlier this year, the Office of Child Care introduced a new rule for the Child Care Development Fund, so the Child Care Assistance Program, essentially, that lowers costs, or it aims to lower costs for families that receive child care subsidies. There's language in order to improve payment practices for child care providers, language around increasing families' childcare options. And given that the CCDF program is operated through a block grant to states, there are a number of really important questions about how states are actually implementing these new rules and how these new rules are impacting the experiences of Black families and Black providers who accept subsidies. And you can visit ACF's website to learn more about the new rule. And the last new rule that I just want to highlight is the new rule that was issued at the end of this summer for Head Start, requiring Head Start grantees to improve wages, benefits, job quality for Head Start educators and other staff. And I think similarly, there are just a number of questions about how, these provisions influence the African American workforce in Head Start. So I will now turn it to Megan to talk a little bit about some reflections around TANF. Go ahead, Megan.
But yeah, I definitely want to emphasize, Amanda's appreciation for Dr. Rollins and her colleagues at the Center for doing this. This is a really important step for understanding, the experiences of African American children and families in these various programs. And as Dr. Rollins said, I work in the Division of Economic Independence in OPRE, where my division's largely funded through the Temporary Assistance for Needy Families, or TANF legislation. So that's what I want to focus kind of my remarks on. And for those of you who are unfamiliar with TANF, very briefly, it's a federally funded program that provides financial assistance to families and children who are experiencing economic hardship, and it's administered through block grants to states. So states can use these funds to provide cash assistance, as well as to fund a wide variety of programs and initiatives that need to be kind of broadly aimed at strengthening families and their economic circumstances, with a specific focus on work or employment. So I first want to definitely emphasize the points that both Dr. Rollins and Dr. Coleman made about administrative data, especially in my remarks as they relate to TANF. So building off their comments, I have a few kind of challenges to highlight. The first is that, due to the block grant nature of TANF that I just mentioned, so states have kind of wide discretion to use those funds that they get to both provide cash to families, and also to provide a wide variety of programming and initiatives that relate to economic self-sufficiency and employment. So the cash assistance part of TANF is actually a relatively small part of that. And this presents at least two challenges for achieving the center's research priority, right, of understanding barriers and facilitators that impact human service provision to and utilization by African Americans. So the first challenge is that, because it's a block grant, each state has different entities collecting different data on the use of the funds and on the cash recipients themselves. So, and in some states, the program is administered and the data collected at the state level, and in most, it's at the local level, like states or counties. So this means there isn't a lot of central places or consistent data across states, because, like Amanda mentioned, these data are not collected for research purposes, right? So including the purpose of comparing much across locales. So of course, without these data readily available, it's hard to identify trends for African Americans or for any group that would help identify inequities and in access and take up and in the level of benefits. A second challenge is that if we, and this is like a big challenge, but if we want to really understand the full impact of TANF as a kind of funding stream or program writ large, we'd really want to understand how TANF expenditures, other than those used for cash assistance, reach or don't reach, in this case, African American populations. And again, because of the previous issue I mentioned of this like devolution to the state and local level, that can be challenging. It's very challenging to do, to understand not only where those expenditures went, but also who did they reach, were they effective, and things like that. So that's a pretty big challenge. And a third challenge I want to highlight, again, building off what Dr. Rollins presented, right, is that federally, the only performance measure for TANF is the work participation rate. or the WPR, and that's calculated as the percentage of work eligible participants who are engaged in work activities. So, given this heavy focus on employment, so that's really some of the only nationally available data on TANF. But it also means that other research, that may rely on survey data or examine a subpopulation of TANF recipients focuses on employment, which, of course, makes sense given the focus of the legislation. But even if that's what one, does choose to focus on, which I'll return to that in a minute, administrative data on employment, especially we often work with data that comes from the National Directory of New Hires, doesn't include many types of employment, like self-employment, and this is becoming an increasing problem with things like, the gig economy. So that really gives kind of an incomplete picture of employment, even if that's the outcome that we want to look at. So while there are those challenges, there's also some opportunities and interesting ways people are thinking about how to better, understand TANF recipients, where TANF funds are going, and the related, equity issues embedded in those topics. So one thing I want to highlight is the work of ACF's TANF data-related projects. And, I'm now realizing I was going to put links in the chat, but maybe we can send them out afterwards, or you can Google them. There's the TANF Data Innovation Project, and also the TANF Data Collaborative. These are two projects overseen by OPRE, which have focused since 2017 on supporting state and local TANF agencies to expand their use, integration, and analysis of TANF and other administrative data, so to kind of strengthen their evidence-informed decision-making. And this also explicitly includes a focus on examining equity within the TANF program to improve program administration and outcomes for families. So, they've produced a fair amount of work on working with those state and local agencies that I, recently mentioned to kind of beef up their data and the ways that they use it. So they're, looking for innovative ways to be able to use what data are available, think about what additional data could be collected, and use them to examine a variety of topics, including equity. And one other thing that I am very excited about, the last thing I'll mention are these Fiscal Responsibility Act work and family well-being pilots. So this kind of returns to that issue earlier that I mentioned, that the TANF legislation and most research on TANF, because of that, really focuses on the work participation or employment rate in terms of deeming whether the program is successful, is doing what it's supposed to do. But with these pilots that were authorized in the Fiscal Responsibility Act of 2023, 5 states have just been chosen to participate in the pilots, and they'll negotiate performance benchmarks for work and family outcomes for recipients of TANF assistance. And that can include outcomes beyond whether someone's employed. It will also include, things like earnings and various measures of family stability or well-being. So the states, will be negotiating alternate benchmarks that they can use, and the pilot will, OPRE will be participating, or will be leading the pilot to assess differences for TANF participants between pilot states and non-pilot states. So that is very exciting. This is very new. The states that were selected, I think, were just selected last month. So definitely stay tuned to that. This is a pretty big deal, I would say, in the TANF research world, and it's exciting to see that they're, piloting how to think about outcomes for TANF recipients based on, things other than just employment rates. So that's that's what I wanted to say, and I guess I'll hand it back over to Amanda to talk about, kind of close out with the discussion of the ACF data strategy writ large, which is also very exciting way that OPRE is continuing to think about and advance data, use of data, within ACF and really across the federal government and the field writ large. So, Amanda, take it away.
Thank you, Megan. Yes, so I think we, like Megan said, we just wanted to sort of wrap our remarks up with some reflections about some few broader efforts in ACF that we think is relevant to the use of administrative data, but also survey and other data. So as Megan mentioned, the new ACF data strategy, it was released earlier this year, and in summary, it's really just designed to help us, better deliver and serve families that can be touched and are touched by the Administration for Children and Families, the families, communities, children. And one of the components that I just want to highlight of the data strategy, and it's available on ACF's website for you to look at more closely, is that we are building an open data plan for all data that's produced or managed by ACF. And this includes administrative data as well as data from our research and evaluation studies. ACF has a real commitment to making our data stronger, but also available to the public, to researchers, to gain more insights into ACF-funded programs. And so, I think this is an important effort to strengthen our administrative data, but to also increase opportunities for those partnerships that I mentioned between the federal government and researchers. Another effort I want to highlight is our Child and Family Data Archive. And this archive is sponsored by OPERI, and it provides access to a wide number of data sets for secondary analysis, mainly in the early childhood area. This includes data sets from surveys that have both been funded by OPERI, but also other sources. This website has detailed sort of documentation, training materials, and it's a great way to explore the various data that may be available to answer policy and practice relevant questions. I think this is the last broader effort that, no, this is not the last one, the second to last one that I want to highlight is just to emphasize the more recent OMB guidance on collecting race and ethnicity data. So one of the limitations that Dr. Rollins mentioned in her presentation is just not being able to take a more nuanced and in-depth look within African-American families and communities. And this recent OMB guidance requires federal data collections essentially to collect more detailed information beyond the high-level categories, such as like Black, White, American Indian, to better capture ethnicity, to better capture country of origin. So for example, you can see in this image that this is an example of how you might implement the new OMB guidance, where folks are given the option to select Black or African American, but they can also select Nigerian, Jamaican, Ethiopian. And this guidance applies both to the survey data that is collected by the federal government as well as the administrative data. Now, there's some exceptions that agencies can fall under to not collect this detailed information, but they are supposed to default to the detailed categories. And this is a pretty significant development, which I think will have a lot of implications for researchers' abilities to take a more nuanced approach at analyzing data for African-American families, but even in general regarding race and ethnicity. The last point I want to make is that there are some really important opportunities that the research community has to weigh in on what is collected by the federal government. So I think the data scan revealed a lot of challenges with being able to answer important questions about the experiences of African-American families in ACF programs, and also their characteristics. But for all data collections that we do that involve more than 9 individuals, we are required to publish a notice about this data collection in the Federal Register, technically 2 notices, and the information, including the study design, the instruments, are all available to the public to comment on. And there's usually first a 60-day comment period where the community, the public, can submit comments of things that they feel like we're missing, questions that, that they feel like highlight questions that may not be worded properly, to highlight other priorities that we should be considering. And I encourage you all to sort of take advantage of these opportunities, because we are required to look at every single comment and consider every single comment like substantive comment that comes in. So this is an important opportunity to sort of build on some of the limitations that these centers scan revealed about these data sets, to try to kind of make these data sets stronger and more able to answer important questions. And I just, that is all I think we had to share. So I will turn it back to you, Dr. Rollins.
Awesome. Thank you, Dr. Coleman, and thank you, Dr. Reid. Were you going to say something else?
I was going to just say very briefly that the Child and Family Data Archive that Amanda mentioned, we also host some employment and training, family self-sufficiency, TANF-related data there as well from our division. So just wanted to add that resource is even broader than she described.
Okay, so in a whopping 7 minutes, we have a few questions. So one question was about, where would you start to ask better and more equitable research questions to center Black families and the breadth, variety, and significance of their experience using existing data sets instead of where we might be today. So I can start off, and then obviously if you all want to weigh in, but as far as starting with better questions, definitely centering those around folks' lived experience. And so the way that we have been working with developing our research agenda is talking to program participants, talking to caregivers who might potentially be eligible for these programs, and trying to understand their experiences. And that's kind of how we shaped the research questions and areas of interest. But yeah, just from looking at the data sets and just wanting to know some general things, just general background information about some of the families, it was still kind of a challenge.
I think that's right. I don't have very much to add, except for just to kind of emphasize the point that when sort of identifying the right questions, just starting with the folks who have a vested interest in the broad topic that you're considering, and seeing what things kind of are they concerned about. There are, a number of good resources out there on how to sort of center equity in the research process. And, I know definitely that Child Trends has some, the Urban Institute has some good resources. So there are also a lot of resources that you can sort of just look at, and they may help you give some ideas about where to start.
What strategies can researchers use to address gaps or biases in existing data sets when studying African American children and families? So for us, we really, before we used it, we reviewed to see the sampling kind of design and plan. So some data sets we didn't use because of however, not being able to see that it was representative, not being able to see that there were a lot of African Americans or Black folks that were included. You may also look at kind of the data collection tool, like some of the questions that are asked, to see if it, maybe there's a negative or deficit bias that is existing in those questions, which would make you not want to use that data set. But that's typically what we did, kind of looked at the sampling plan, looked at you know, the different types of questions that were asked, and how many kind of folks were actually included, African Americans, Black folks were actually included in a data set before deciding to use it. Let's see. Tips on how to not be overwhelmed with the variety of options for data sets and how to pick one. I'll let you start, Dr. Coleman, and then I'll jump in.
Yeah, that, there are, and if you go to the Child and Family Data Archive, you'll see tons and tons of data sets. I think that once you sort of get, and, instead of starting with the data set, I think starting with your questions, and looking for, existing literature on those questions, get a sense of like, if some of those data sets that folks use to answer similar questions, if those data sets are available, well, what I'll say is many, if you come across OPRE resources, like reports and things like that, many of our data sets are available for secondary analysis. So depending on the type of data you're looking for, sometimes starting with government reports too, and making sure that's included in sort of like your literature search or scoping work, that can also point you to potential data sets that may be archived with the Child and Family Data Archive as an example.
Yeah, and so like I shared with you all, there winded up being, limited data across a number of data sets. And so if you already have an idea of what you're trying to find, that can really narrow your scope quite a bit. So yeah, there's a lot of data sets out there, but do they really fit what exactly you're trying to answer or what you're trying to explore? That may narrow the number of data sets down. So there's a number of great resources there. The Child Trends Research Report in there. I see a couple of links from our OPRE colleagues on Child and Family Data Archive, a number of things there for you all to get. I think you are able to save the chat. So click those 3 dots in the chat and you should be able to save it if you want to keep those links. Also, be sure to take our survey. Let us know your thoughts and feedback on this webinar. And feel free to reach out if you have additional questions, about this work or anything else that we have going on at the center. Thank you all for spending this time this afternoon with us, and we look forward to continuing to work together. Have a great rest of your day.